Madera Community announced today it plans to file for bankruptcy and close its doors.
The hospital is losing more than $2 million a month.
And just minutes ago, Madera Sheriff Tyson Pogue declared a local state of emergency.
Esa es la preocupación de muchos ante el cierre.
The hospital that's been here for more than 50 years
serves 150,000 people.
Is now planning to close its doors for good unless something happens fast.
Patients will now have to travel longer distances. All employees will be laid off.
Impacts of the closure will be felt well beyond Madera County.
Hospital employees are in shock and residents are wondering what comes next.
I would definitely describe the residents here of this county as extremely passionate. Maderans love Madera, and they will stand up for Madera. They're hardworking people.
I lived here all my life. I love Madera. So you have to learn to be good to everyone. You know, a lot of people need this hospital here. You know, a lot of people don't have vehicles. The cities around here, need it. So bring it back.
It's been over a year since the hospital closed, and we still are feeling the impact of the hospital closure every day.
There are times where we're double booked. You have that 15 minutes to talk to the patient, figure out what's going on, diagnose them, and go ahead and treat them. Now you're seeing 2 patients in that 15-minute slot, right?
Es algo elemental, básico, un hospital aquí en Madera. Acabo de tener un familiar que iba enfermo, lo tuvieron ahí muchísimo con un dolor porque ni siquiera había camillas para urgencias, de que están saturados los hospitales de Fresno. No son suficientes para todavía llevar la gente de Madera hasta Fresno.
If somebody's having chest pain, time is of the essence. We call it door to needle time.
Having something close that's 5 or 10, 15 minutes away, and now you have to drive 30 more minutes on top of that. Each minute in those kind of situations is a huge effect.
Madera Community Hospital was a major economic engine for the restaurants, for the hotels, the motels that are in that area.
All the gynecologists have left. Most of the surgeons have left. Infectious diseases have left. Hematologists have left. So we have very few doctors left over here. It's a ripple effect. It's a domino effect.
The closure of that hospital has the potential impact to change the city of Madera from a town to a gas stop on the 99.
This is not a one-off. Small rural hospitals who primarily take care of Medi-Cal populations really struggle to provide the care for the reimbursement that they receive.
I went on record that I've lost 2 patients within the first couple of weeks.
It's those lives that we lost. It's our elderly community that don't have anybody to take them to the hospital. It's farm working families that maybe don't speak the language. Those are the conversations that consistently need to be in the room whenever the hospital is talked about.
Que mayoría pues gente que trabaja en el campo. Y gente que vive nomás pues de cheque a cheque.
Ahora le manda hasta Clovis, hasta no sé dónde para hacer análisis, todo lo que necesitemos.
I think we have to have conversations that aren't just about more carrots. I think the public deserves to have some sticks to make sure that there's adequate transparency, so there's less conflict of interest, and that they actually have a voice on some of these hospital boards.
Small hospitals feel familiar because this is what you've known your whole life. Losing that for a lot of people, it's kind of like losing home.
Ultimately, the hospital just means everything to this community and to this county.